Germany has launched another push to encourage people to get vaccinated against COVID-19. Just over 60% of people here have been jabbed, far fewer than in some other European nations. The majority of patients in intensive care are unvaccinated. So why are so many Germans still reluctant to get the shot? We'll be asking a doctor and politician in a moment, but first this report.
Getting the shot during your lunch break, without appointment and free of charge. This little stall in Berlin-Kreuzberg is part of a special week-long drive in Germany. The idea, to make it as easy as possible to get vaccinated. The organizers say it's working. We've had over 80s who received their third vaccinations, various people getting their first vaccinations, so a mixture of people who really decided spontaneously while shopping and people who came here after hearing about it in the media. All over Germany, health workers are trying to reach people who have yet to get a shot, as the country's vaccination campaign sputters. Germany wants 75% of the population to be immunized against the coronavirus heading into the fall to prevent a deadly surge of infections. So far, only just over 62% have received the necessary shots. German President Frank-Walter Steinmeier has also stepped in to do some convincing. Now it's important to tell people again, it's not just about you. When you decide against vaccination, you're not only deciding against yourself and risking your own health, you are also risking the health of others. Most COVID-19 patients in intensive care in Germany are now unvaccinated. The government has stressed time and again that it's not planning on making vaccinations mandatory. But several of Germany's 16 states have started restricting access to certain venues for people who haven't received their shots. That's a persuasive reason for some to get the jab, like here in Munich. I'm fed up with these restrictions, always having to be tested and all that. And for him, there's even a reward waiting, a ride on the Ferris wheel.
For all of this, I'm now joined by Dr. Janosch. Dahmen is a member of parliament in the opposition Green Party and also a medical doctor. Germany's vaccination rate has stagnated and is below a number of European countries like Spain, Denmark, Portugal or Belgium. How do you explain why Germany is so far behind?
Well, the national vaccination campaign is too slow, and there was not enough effort in the government's action for this vaccination campaign. Overall, I appreciate the combined effort to make getting a jab as easy and convenient as possible, which is happening in this week right now. But I unfortunately have to add, finally, given the current stagnation of the vaccination numbers in front of the backdrop of rising hospitalization rates and also the high infection rates. This vaccination week, Jens Spahn, the health minister, announced is just too little and too late. And yeah, to my opinion, from now on, every week has to be a vaccination week. We are running out of time. Autumn is coming and the winter is coming, and we have to fear that we are facing a very heavy fourth wave over here in Germany.
You just mentioned the fourth wave. Germany is already somehow in this fourth wave. In all previous waves, the health service coped quite well. Are you concerned it might get overwhelmed this time, or that the death rates will rise exponentially?
Well, Germany already lost about 100,000 lives over here in Germany due to that awful pandemic. So there is a high price Germany paid. And also, if I talk to my colleagues on the intensive care units and in the hospitals, they are tired. They have really no power to stand the heavy fourth wave again. And I'm very, very concerned that this is not only a problem for the people who get infected, but for any emergency who has to be treated in a hospital. And so therefore, we have to take strong actions to get this fourth wave under control.
You mentioned the intensive care doctors that you've been speaking to. What can be done to relieve the pressure? Can you hire more doctors? Would that be an alternative?
Well, there is probably not a fast measure which scales up the capacity on our intensive care units or our healthcare system in general. We have to speak after the pandemic about measures which strengthens the resilience of the whole healthcare sector in Germany, and have to ask, what are the emergency capacities we want to build up so that we are better prepared for future pandemics? But looking at the situation right now, I think the best thing what we can do for my colleagues in the hospital is keep the numbers down of people who need to be treated in a hospital. And the best thing to do that is either get the people vaccinated more faster, and also due to testing, keeping the dynamic and of this fourth wave under control.
Janosch Dahmen there, MP for the Green Party in Germany. Thank you.